Hi, I'm Brad Roldan, VP of Product here at Bandwidth, and I've actually spent the last few years working with our healthcare customers to accelerate their adoption of communication technologies to facilitate patient engagement. Now, before we jump into our main topic, I thought it'd be helpful if we could do a little background on Bandwidth. For those of you that don't know, Bandwidth is a global CPaaS. It's a communication platform as a service, and we deliver service in over 60 countries. We do that by delivering a cloud-ready voice, messaging, and 911 capability for enterprises and application developers. Now, whether you're going through your own digital transformation journey or seeking a partner for digital engagement, Bandwidth is at the heart of your communication stack. We're proud to call some of the most innovative tech companies in the world our customers, some of the companies you may have even heard of, like Microsoft, Zoom, and Cisco. So let's do a quick overview of the opportunities ahead of us for communications in the healthcare space for patient engagements. First area I think we're all intuitively aware of, improving access to care. It's what we measure our success on, at least for most of us. The next area that we'll look at is optimizing patient outcomes and how communications can improve those. Now, the third area might come as a little bit of a surprise, but we're going to talk about increasing expectations from patients driven from a consumer mindset. And the fourth one, if you're an implementer, is we're going to try and answer the question, how do you actually get started? How do you actually implement? So let's jump into it. The first opportunity, access to care. So many of us have had the opportunity to experience some form of telehealth over the last few years during the pandemic. It's an experience that's been long in coming. As technology has matured, we are now finally hitting a tipping point where insurance carriers are now offering coverage for telemedicine services. The experiences have matured to a point where they're good enough for general use and not just early adopters. So you might be asking yourself, what is telemedicine? You might have heard of live medicine, for example, which is what we've all probably experienced at some point during the pandemic, like a live video session with your primary care physician. You might have heard of remote patient monitoring, which allows doctors to monitor their patients from a distance. And you may even be familiar with mobile health. These are essentially devices that enable healthy practices within our own lifestyles. But have we really addressed the problem? Have we improved access to care? I can tell you in my own experience in the last year, I tried to set up a telemedicine visit, a video visit with my doctor. And after minutes and minutes of futzing around, my doctor gave up. She said, you know what, let's go meet on something else. And we ended up picking a consumer grade platform for our telemedicine visit. It's not a matter of technology literacy. In fact, ultimately what happened was technology failure. It was a video plugin that failed to load correctly on the consumer browser. So where we find ourselves challenged is that we are trying to deliver a consistent patient experience across an inconsistent set of technologies. And these are the technologies that the consumer brings, that your patient brings to the table. Not all of us have the latest web browsers. Not all of us have the latest iPhone. And not all of us have gigabit internet speeds at home. And so I'll leave you with this thought as you are going through your own journey of selecting your partners for implementing your telemedicine solution. Make sure you're picking a partner who understands the challenges of working with inconsistent technology stacks. While everything might be the same on your side of the equation as a health provider, the consumer side is actually varied. And so you'll want an expert who understands what it means to work with inconsistent broadband access, inconsistent technology stacks in the web browser. Collectively, our goal is to lower the barrier to access for telemedicine for the entire community. Now let's move on to the second big opportunity ahead of us, optimizing patient outcomes. Now this is an area that we likely all care deeply about. After all, it has a direct ROI that we can track against improving access to healthcare. There are many areas we can try to improve outcomes in, but for today's discussion, let's look at three distinct areas that we can likely improve without a lot of effort. Now, the first area, health literacy. We know that lack of health literacy costs us hundreds of billions a year. Now, health literacy ultimately answers the question, do people have the information they need that allows them to make health-related decisions? Second area we'll take a look at is medication support. It's no secret that non-adherence is a leading cause of treatment failure. And of course, no-shows. We have taken for granted that this is a normal course of doing business. The reality is that no-shows translate into an inefficient use of our resources. So what tools do we actually have at our disposal to drive changes in these three categories? Why don't we consider SMS? It's already ingrained in our consumer ethos. It is part of our daily lives. And in fact, when you consider the ubiquity of SMS, it is more likely to get a response from a consumer, or a patient in this case, than your attempts to reach that same person through email or voicemails. So let's put this all in perspective of the three areas that we just talked about. Well, on health literacy, you can imagine that if you have a 98% read rate on SMS, you are now getting a higher chance of putting the right level of information into your patient's hands. In the context of medication support, the near real-time read rate of SMS means that patients are more likely to continue following the prescribed program. All we need is a gentle reminder. And in the context of no-shows, the high response rates for SMS means that patients are more likely to confirm or reschedule their appointments and reduce the number of no-shows coming to your facilities. And moving on to our third opportunity, increasing patient expectations. Now, in this context, we're really talking about consumer experiences and how our expectations are influenced by daily interactions. Think about your own personal lives from the perspective of a consumer. One-day shipping for online orders, 1-hour delivery windows for online grocery shopping, instant access to streaming content. And how does this apply to healthcare? The themes are fast, convenient, on my schedule. As we modernize our health experiences, we need to be designing those experiences to match or exceed current expectations. Now, let's be clear. We're not talking about inpatient medical procedures here. We are talking about transactional patient and provider interactions. So some areas for you to consider. First, consumers are accustomed to multiple communication channels. How are your patients able to reach you? A phone number is not enough in a world where we have WhatsApp, Apple Business Chat, and SMS. These feed into our need for fast. It's definitely okay to introduce AI and chatbots to help drive transactional communications. Think about automated scheduling and bill payments. These fulfill our need for convenient. And the last area to consider, patients driven by consumer behavior expect choice. What alternatives are you enabling to allow for patients to consume services in a manner that works for them? How are you working with the patient's schedule? So these are just some of the questions you should be asking yourself as your team designs a modern patient experience. Moving on to the fourth opportunity, your journey to the cloud. Now, if your job is an implementer, meaning that it's your job to implement health IT systems and help your organization migrate technologies into the cloud, you might be scratching your head, where do you begin? After all, OCS delayed enforcement of PHI compliance for telehealth during the pandemic. You've likely got an existing technology stack that you're trying to move to the cloud, and you're probably getting a lot of pressure from your digital engagement teams to turn on new capabilities for patient communications. There's no single path to digital transformation. However, picking a global CPaaS like Bandwidth means that you're working with a partner who understands the difficulties of managing regulated environments such as healthcare. And with that, thank you for your time. Hopefully you've learned something new, and we look forward to hearing from you no matter where you are on your journey.